Today is our amazing panel of judges, whom I will introduce in a minute. Allow me to reintroduce myself. I am Soraya from AMSA China, and I will be guiding you through the presentation session as the moderator. Keep in mind that your group's presentation will be cut after the 7-minute mark, and you will be having a 3-minute Q&A time from the judges after. Now, I would like to introduce each of our judges. First of all, we have Dr. Yasir Ahmed Mohamed Al-Hadi. Yasir Al-Hadi is a distinguished public health professional in health management, policy, and research. His career includes roles as research assistant at Abu Dhabi University, a research consultant at King Fahd Medical City. He has been notably recognized with the Hideo Noguchi Africa Prize for Young African Scientists in 2020 by the WHO African region. Early education to public health extends beyond his professional roles, as seen in his volunteer work at improving health outcomes in challenging environments, particularly in Sudan and across the MENA region. Dr. Al-Hadi will be joining us soon. Next, we have Dr. Aksha Noor, Master of Public Health. Dr. Aksha is a WHO Global Diabetes Compact Consultant and the Executive Assistant to the Vice Minister of Health Indonesia. He also has over 8 years of experience, spanning from practice in medicine in rural primary care, leading the implementation of national pandemic responses, mobilizing resources from the private sector and philanthropists, and influencing policy at national and global levels. He was part of Harvard Medical School Southeast Asia Leadership and the WHO Young Leader Network programs. He completed the MPH program at the Johns Hopkins School of Public Health and Medicine from the University of Indonesia. Hello, Dr. Aksha. Thank you so much for your time and attending our session. Would you like to express about your feeling today?
I'm very excited and to meet you all today and look forward to all the projects presented by the participants. Thank you.
Thank you so much again for joining us today. Last but not least, we have Kenneth Lam for the Medical Student Perspective. Kenneth is the Regional Director of International Federation of Medical Student Association, also known as IFMSA, Asia Pacific. As a student leader, I am sure that he has a lot of insight to share with us on what is possible within our scope of medical students. Hello, Kenneth. Thank you so much for your time also attending today's session. Now, we go to the presentation of the first group, which will be from Group 6. Group 6, the time is yours.
Good afternoon to our respected panelists. My name is Sakila Katrita, and you can call me Lala. I am from AMSA Indonesia, and I am from Group 6 here. So I would like to present about the discussion topic. Allow me to present. So allow me to read about the case. First of all, The case is medical student from University Z plan to reform their activities, previously focusing on medical students only and started reaching out to local high schools. They wanted to improve these students' health literacy. After several unresponsive schools, they finally settled to execute the activity in a private high school, mainly composed of upper middle income students, and the healthy literacy program mainly teaches nutrition and the importance of eating vegetables. Nevertheless, this high school student usually have their lunches from the school canteens, which deliver healthy, balanced diet daily. And moreover, as the program is delivered through a lecture format, most students slept through the program. Based on our discussion, there are three questions that we would like to answer here. First of all, is what went well in the project and how has it effectively impacted the community? Here in our group, there are several opinions. First of all, is from Andrew, and second of all is from Utkarsh. They both agree that it is good. What is good here in the project is they are using about a topic that is very related to students this year about nutrition and health, and they are very inclusive and daily based, so it is very related and easy to be understood by students this year. For the second question here, what has potentially been misdirected or suboptimal in the project? Criticize it. Based on our discussion here, there are three opinion here from Leonie, me, and Andrew. Here we all agree that the project is held in private school, but it is more um, but maybe it will be more effective if the project is held in public school, because public school usually have students with a low middle economy status, and because the school tuition is lower than private schools, so students in public school usually bring food by their own, not served by the school like private schools. So basically in public school students, they usually search their own meals and they have to know which meal that is more needed by themselves. And secondly, it is I think we think it is better if the project is held not in the form of lecture, because it is not really engaging. It is not very interesting for teenagers in senior high school. And the last one is from Andrew. Andrew is saying that maybe we have to check that the topic here is ever been taught before in the school, because if we are teaching about something that is actually already been discussed before by the school or by the students, maybe it is not very related, or it's not very engaging for the students to listen to. And the last one is opinion from our friends. Our Here from Utkarsh and Daniel. Daniel said he said that I think the OC should take more time in finding school that suits the topic, which is nutrition and importance of eating vegetable. So he is here saying that maybe it will be nice if we are if we are making a program based on a problem that is in the place or in the uh, area, not finding the school first then making the topic. So it will be nice if we give a more related topic based on the condition of the school or in the area. And for the third question here, what solutions do you think would have prevented problems in point B, or are better suited to be executed? Here there are many people in our group that giving the opinion. The first of all is Utkarsh, Margaret, Leonie, Daniel, and Josia. They all agree that maybe it will nice to give the program to make the program more interactive, like giving a Kahoot, giving quiz, or maybe the committee should change the target participants since the participant come from upper middle class or apply new concept. For example, we can make the high school student as agents to promote health, or in this case nutrition and importance of eating vegetables. So in their opinion, the committee should make a health campaign to give education regarding public health. And they also agree that maybe they should change the target school, not private school, and they should modify the topic brought in the health literacy program by doing preliminary survey. That's all from us from Group 6. Thank you.
Thank you so much for this speech. Now we will welcome questions from the judges for the insightful presentation. For judges interested in inquiring further, please raise your hand. Yes, Dr. Aksha.
Yeah, thank you. I think that was a very good presentations. Akila, only have several questions for you. One is, what are the health challenge your group ever see or observe about nutrition issue among students in high school, and how does the solution actually address that problem? Second question is, who do you think the other stakeholders you should engage when you come to the school to ensure that your solution will be sustainable? Thank you.
Okay, thank you, Dr. Aksha, for the question. Or maybe from my group would like to add an opinion from Dr. Aksha's question. Okay, maybe I would like to answer the question first. From what we search, there are there are some health problems that we could see in students. Basically, we usually see health problems in students with from public school and students that are having troubles with economic things. So they usually when we talk about economic status, that is usually related to their life, their how they eat, how they live, and usually people that have problems with health are people that doesn't have many time or doesn't have many money to know which food that is more needed by their body and which food is not. So maybe it will be better if the program is given to people that have a low economic status and students that maybe don't have the chance to understand more about the health and uh, food good food consumption as well for me.
Thank you, Akila, for the answer. I think Kenneth also have a question for Group 6.
Yeah, I'm not sure do we have the time, but thank you very much for the comprehensive presentation. I think that you listed
No, that's okay. There should be time.
Yeah, we listed a lot of obstacles that might be happening within some global health activities. So I think one of my question will be on in the practical settings, what do you think might be a factor that it will be easier to communicate or collaborate with private schools than public schools themselves? Because we do see these two different group of people. They might be different stakeholders as well. So why do you think there might be a reason of differences of the willingness of collaborations of conducting activities? That will be one of my questions. And then the other question is, in case that usually you said that I think in one of your comments you said that you would like to change the topic that will be more relevant, but I think in my experience, most likely we usually send the topic to the school and then they agree upon. So in case if this is the set topic, what we would like to further develop to make it more adjust to what do you think will be relevant to a high school student that is from such a high income background. Thank you.
Thank you for the question, Dr. Kenneth. Yes, Elizabeth.
Okay, sorry for interrupt Akila. I am the group moderator for group 6. So let me just help Akila to answer your question, sorry, Dr. Kenneth. So in Indonesia, public school and the private school are very different. So in Indonesia, public school means that the government will charge the students by a lower price so that they give them the nutrition. If the school provide the nutrition, they will give it more cheaper than the actual they have to get. But if the public school, but for the private school, the students can bring their own food. So yeah, we can bring our own nutritions that may be more complete for the nutritions. Yeah, sorry. Yeah, thank you, Akila.
Thank you, Elizabeth. Yeah.
Okay. Can I answer your question?
That will be great. We can move on to the next group. Thank you.
Perfect. So thank you for the intriguing question and answers. Now we proceed with the second group. So group 4. Group 4, you can start your time. It's yours now.
Okay. Hello, everyone. My name is Clara, and I'll be representing Group 4 for the discussion results of our critical appraisal. So, next slide. So, based on the given case study, we have concluded on some advantages of this project as well as some certain areas of improvement. Next. I'll just be continuing. So for the project's pros, firstly, the project, it provides general medication and education, which raises awareness of specific health issues among the residents of the rural area there. Yes, okay, thank you. And this also contributes to the multidisciplinary nature of the project, as there are like several divisions involved, including education, creative economy, and green environment. For the health services specifically, they are pretty comprehensive, as they check patient vitals, medical history for immediate medication. Lastly, the project has great potential to encourage others to carry out similar projects. However, for the project's cons, the project is not very resource and time efficient, as the volunteers have to travel by sea for 5 days, affecting the project efficiency. And it is also clear that the planning and data gathering stages of this project is not very well executed, as they missed the scabies case, which is actually a common disease in rural areas. And this occurred probably due to the lack of collaboration with the local healthcare workers and government there. Also, the case does not mention any long-term follow-up for the chronic conditions treated. And furthermore, there aren't any actually like specific indicators to measure the project sustainability. Next. Okay, so considering those points, we propose some solutions to improve this public health project. So firstly, it's important to survey the community first. So before starting the project, we should gather information about what the local community needs so that we can tailor the project and equipment accordingly. And then next, we should use collected health data and also collaborate with like relevant stakeholders such as local healthcare workers so that the targeted health education and awareness initiatives can be advanced for the community there. And next, we should also secure donations of essential medications from local businesses and also governmental authorities. Next. And it's also important for the planning stages to utilize local government data to determine the disease prevalence and trends in rural areas so that any important disease such as the scabies case in the village won't be missed again in future public health projects. Next, sustainability is also a very important factor. So the project should implement mechanisms to ensure sustainable project outcomes. So this includes coordination with local healthcare workers to measure the health status and well-being of the residents there. And also there should be more efforts towards addressing the scabies problems. And this can be done through health education and green environment efforts. Next. And lastly, we also think that it is crucial to encourage self-check-ins to healthcare providers in the rural village and also empower those healthcare providers so that they could help the local community there instead of the residents just directly prescribing medicines for themselves. And that's about it for our group's discussion results. Thank you.
Thank you for your presentation. It was very insightful. Now, if any judges have any question, please raise your hand. Kenneth. Yeah, go ahead.
Thank you so much. So I think it was like you kind of tackle different perspective of some of the issues, and you definitely identify things that went well for the program. So I only have one question. So one of the comments that you said that you can collaborate more with different stakeholders, and I think most likely you only work with the local government, like with data and stuff. But with what I've just seen, I do think there might be a lot more stakeholders that do like to collaborate to enhance the effectiveness of this global health project. And yeah, and name some of them if you have something in mind. Thank you.
Okay, thank you for the question. Maybe some of my other group members can add for this, but what I can think of right now, probably, certain other NGOs who are also invested in similar causes that are related to the public health project. You collaborate with them. And I think it's also important to inform also other relevant like government agencies such as like the Ministry of Health that we are doing this project to enhance the effectiveness of this in a public health project. But perhaps some of my other group members can add to this question.
I think from a public health standpoint as well, it's also possible to address the education side of it all. So maybe collaborating with the local education ministry, implementing it into school curriculums would also be another step.
Yeah, sure, Nathan, you can continue with the question.
I think Nathan can continue.
Oh, sorry. Okay, yeah. So besides just collaborating with governmental organizations and non-governmental organizations, I think from a public health standpoint, education is also quite an important factor in terms of guaranteeing like long-term health outcomes. So collaboration with the education ministry, making curriculum changes to like maybe primary schools, secondary schools, and just improving overall health awareness in the population would be the best way to guarantee long-term health outcomes.
Yes, Dr. Aksha, do you have any other question?
Yeah, just quickly ask to Clara's group. If you were part of the group, were you still thinking to going to visit this sort of village, and if you have the resources, I think it will cost you a lot of resources to do that. If you ever do that, what would you do differently with your group, and would you think to involve others to also participate in your project? I think you'll do these sort of things in the future. Maybe not. Thank you.
Maybe I can give like an initial answer. So considering, yeah, as what you said, there are a lot of resources that have to be expended for this project. So perhaps this kind of project that involves, long distance travel could incorporate more, as we explained before, like governmental and non-governmental organizations. I think it could be more large scale, the public health project. I think perhaps for us, if we were to do some like a similar public health project in the future, and considering that we're still medical students, perhaps we still have to do it in still like a rural area, but maybe much closer distance and much in an area that is more feasible for what we can do and resources that we have.
Okay, thank you so much. Just a small notice. So Dr. Hedy couldn't come today, so we'll have Jericho Gaya, who will be replacing him as one of our judge. As for the Q&A session, so we will now proceed to the next group. So group 1. Group 1, the time is yours now.
Can you guys see my screen?
Yes.
Okay, all right. Very good afternoon to all the judges here, and I'm Rohit, one of the members of Group 1. And today we're going to talk about Project X, the Wellness Wonders. That's going to be the title for our thing. And here are the group members. Here we have the group moderator, Vaishnavi Sharma, and our members, Yuni, Bunga, Alicia, me, Rohit, Valerie, Ananya, Vincencius, and Panchan. So now we're going to start as a summary of the case. So the main discussion in this particular case is we're going to look at the point that the medical students and the medical doctors travel for 5 days by sea to reach a rural destination, and they stayed 6 days there. And they carried out a health checkup, and they did like the basic health screening. And they also found that there were some children who had scabies. However, they did not have the medication required to treat scabies, that is permethrin 5%, and they only had antihistamines that could alleviate the itch. So now we're going to look at the first thing, that what went well in this project and how exactly it impacted the community. So first things first, the whole project itself managed to improve the community's overall health because they could address like what was usually not seen. I mean, what is not usually diagnosed by a certain healthcare provider there, because the community may not have gotten proper healthcare being provided to them before. So this health checkup managed to just look at the basic stuff like high blood glucose, cholesterol, and conditions like that. And they also managed to prescribe patients with medications that could treat those common conditions. And then another thing was there was a community engagement that was initiated by these medical students and also the doctors who volunteered to join this entire program. And what they managed to do there was they actually kind of showed real resilience and motivation in their efforts, because they literally travel for like 5 days and stayed over in that village, in that community for 6 days. And they actually spend a lot of time focusing on trying to make these communities better. And we also looked at the whole comprehensive approach to community development. Like, this whole project was not just focusing on health care itself. They also looked into education, creative economy, and also the green environment. So I would say that this project managed to really give very sustainable, sustained impact on the community itself. And now we move on to the next question. My teammate here will continue to present this part.
So question number 2, what has potentially been misdirected or suboptimal in the project? So allow me to answer. Number 1, no health research of the target community. So this project has no deeper research on the prevalence of KBS in the target community or location before the project. And number 2, inadequate medicine supplies. The group was unable to prescribe permethrin 5%, the recommended treatment for scabies. And number 3, long and resource-intensive travel time. The traveling time might have been too much and resource-intensive, causing limited supplies. And number 4, no preventive education. So there's a lack of focus on preventive measures such as health education, sanitation, and hygiene promotion, which are important for long-term community health. And next, the limited healthcare and sustainability. A one-time visit by medical volunteers may not address the underlying health issues and will be a problem for the monitoring of medication adherence and effectiveness. And last, possible lack of participant. Because there's a very low number of people participated, only around 40 compared to the amount of time and budget spent. Next.
So I'll be talking about the solutions we think can help prevent these problems. Firstly, partnerships and collaboration. So we could partner up with NGOs who have similar goals or interests as the healthcare providers to improve the quality of services provided. For example, the International Alliance for the Control of Scabies. In this case, partnering with them can help facilitate obtaining permethrin 5% to ensure its availability for the project. Next, pre-project community evaluation. So before the project begins, we could conduct a thorough assessment of the community's health needs to ensure that the medical supply is well stocked. So by collaborating with local organizations, we can tailor the medications and interventions to the specific needs of the community to foster a more effective and efficient project. Next, research and analysis. We hope to conduct deeper research on the prevalence and impact of scabies in the target community for better preparation and allocation of resources for appropriate treatment. The next one is promoting strategies. So we can talk to people who are in charge to spread information through multiple communication channels, and signs or posters could also be put up to increase awareness of this project. A medical post. So by establishing a small medical post within the community, we can provide ongoing medical support beyond the project's duration to offer essential medications and fulfill the required medical needs in the future. Health education and community empowerment. So workshops or training sessions can be conducted to empower community members to take proactive steps to improve their health, such as through implementing proper hygiene practices and informed decisions about their health. This would allow for improved self-efficacy, as members would be able to actively participate in their own health, increasing sustainability in the long run. Next, follow-up and preventive measures. So include monitoring of their health, such as through self-reporting or further health assessments to ensure that treatment protocols are followed and to identify any additional areas where intervention is needed. Lastly, we would also like to help optimize the travel time, for example, through considering alternative modes of transport to increase efficiency. Thank you.
That's it from our group. So thank you, and we're open to questions now.
Thank you for presentation. Yeah, if any judges want to ask any question, please raise your hand. Oh, Dr. Akshat, yeah?
Thank you, Soraya. Thank you, Rohit and team for a great presentations. My question is, as you know that you're far away from this area, right? And then, how do you do need assessment to know what's actually the problem in the area, and to ensure that you're bringing the correct supplies to the community when you travel there. Thank you.
My suggestion for this is because this project itself has other divisions, for example, the education, creative economy, and even the green environment part, they maybe could go for projects that don't require prior research, and we can take part, like a few volunteers can go there to take part in a small research and then see what's required, and then they can come back and give the feedback so that they can be well prepared when they go to provide healthcare services.
I guess I'll
Okay,
go
I see
next.
we have another question from Kenneth. Yes, go ahead.
Yeah, thank you. So I'm just seeing this in another aspect. I think currently in global health, digital health and telemedicine was definitely one of the trends. Like, how do you think this? Like, do you think telemedicine or digital health could be incorporated in this case? If so, like, what do you think could be worked on to improve with these involvement of technology or even AIs? And yeah.
I can answer the question again. Like what you said earlier, telemedicine, we are not sure, we don't have much information regarding the internet connection at this particular area, but if we do think that they have internet connection that can support telemedicine, then yes, of course, we would like to do that so that we can provide more healthcare services rather than these limited ones. But at the same time, if they can't, then we will have to do what we are doing right now, like maybe send a team to do a survey and research more, and then we can provide them with a better healthcare check up in the future.
I see we have another question from Jericho. Yeah.
Hello, thank you so much for giving us a very wonderful presentation. So I'd like to ask, how do you ensure the sustainability of this initiative? I mean, your research for eradicating scabies among these population.
I think I can go for this also. So like under our part where we talked about what can be done better, we thought of implementing follow-up and preventive measures so that the project can be sustainable, because the current solution itself may not be comprehensive. Like we're just going there to give a one-time health checkup, but then if we can either refer the members of the community to go to a nearby hospital to get follow-up care, that would be better. Or maybe we can partner with certain partners who can then continuously provide more and more health checkups continuously, so that even though they don't have like a healthcare setup there, they can have continuous checkups. But if can, we would like to also engage the political support to build like healthcare facilities in that area.
Okay, very well. Thank you.
Thank you very much for this very insightful Q&A. So now I think I can go on with group 2. Group 2, now the time is yours.
Hi, I'm the group moderator for group 2. Let me just share my screen. Okay, is my screen visible?
Yeah, it is. Thank you, Isha. Okay, so good afternoon, everyone. My name is Michelle, and we're from Group 2. I'm going to be accompanied by Florence, Eugene, Nadia, and Natasha. And thank you so much to the assistance of our moderator, Isha. So our public health project Critical Appraisal will be about online-based interactive health campaigns. And maybe we can take a look at the case first. Next slide. Okay, so the highlight of our presentation is that our case is about pregnant mothers and newborn mothers. So we're trying to do increasing awareness projects through Instagram stories and also an online webinar. And some of the points we want to highlight is that, well, yes, our target audience is pregnant and mothers with also those that have newborns. And Instagram campaigns and also online webinars with medical nutritionists. However, there was also a late confirmation of the speaker, and that resulted in lack of publication and 47 participants that have attended, and most of which are also only medical students that are organizing it. Oh, sorry, is my voice audible? Can I get a bit of confirmation? Okay, thank you so much. Maybe I can pass the presentation on to Florence and we can go to the next slide. Thank you.
Okay, so next slide, please. So moving on to the successful factors. So there is the utilization of social media. So this allowed for a wider audience reach, and it also allowed for more convenient and accessible delivery of information on the importance of information of proper nutrition during pregnancy and birth. And this campaign also featured a medical nutritionist to provide accurate and evidence-based knowledge to the participants to enhance the understanding on nutrition. And this also helped to narrow down the target audience, which was pregnant mothers with newborns.
So we have discussed that we have 4 issues identified here. The first one is the late confirmation of speaker and impacting in the late of publication and promotion of the webinar, as they only have 47 participants in the webinar and most of which are only medical students, which it doesn't meet the aim of the webinar's target, which is pregnant mothers and newborn mothers. And the second is the limited promotion through private accounts, where it will not really reach a bigger audiences. And then I'll pass it to Natasha.
Okay, so the third issues identified from the case is that there are lack of interaction between the speaker and participants during the online campaign event, because we know that the campaign is only done through a webinar and there's no two-way communication between the speaker and also the participants. And the fourth is the publication of the campaign has not met the targeted audience, because we saw that the publication is only done through the private account from the medical students, and the participants are only medical students and their peers, whereas the actual targeted audience are mothers and also the pregnant and newborn mothers. I will pass through the presentation.
And so some of the solutions and ideas we have are, first of all, to make a new and separate public Instagram. Oh, sorry. Is to make a new and separate public Instagram account. So just how it was mentioned that the medical students only use their personal Instagram accounts. So by using a separate public Instagram account, we can be able to reach more audience. And next is to collaborate with local organizations such as NGOs. For example, here you can see we found a Foundation for Mother and Child Health, and this can, I guess, access the target audiences, which is in this case the pregnant and newborn mothers. Next, we can also add interactive sessions on the webinar. For example, a focus group discussion to increase participation. So just now it was mentioned that it was only a lecture that will be provided by the nutritionist, and by adding, for example, a focus group discussion, we can increase the interactiveness of the webinar.
So allow me to continue. So we also had this idea to also organize offline events beside alongside the online events, such as workshops, so that we could really increase public interest on the campaign. So for example, we could have like a week's worth of events that could also be a continuous session after session for those who are like really like to develop interest in the topic. And lastly, when it comes back to the Instagram section, we also decided that it would be really useful if we had some sort of broadcast channel, which is like one of Instagram's new features, in the designated accounts to really just broadcast and share information regarding the webinar and posters. And I think that concludes our presentation. That's all our ideas. And thank you from Group 2.
Thank you so much for this presentation. So now we will welcome questions from the judges for the insightful presentation. Please raise your hand if you have any questions to ask. Yes, Kenneth?
Yeah, thank you so much for the presentation. So I think my question regarding will definitely on the online campaigns. So definitely, I think after the pandemic, there's a lot of online campaigns, and like, what do you think will be like, because like it was organized from a medical student perspective and inviting different people. Like, what do you think, like, the newborn mothers or the pregnant mothers who choose to participate in this event? What will be their interest, or what might be something that attracts them to attend such an event? Especially, there will be a lot of available resources to mothers as well. So, what do you think this would stand out? So, what if it's not standing out now? What do you think it could help to stand it up to compared to other events that were held? Thank you.
Yes, Isha, you can answer.
Thank you, Doctor, for the question. I think that's a very valid point because what I feel would attract the audience would be, probably sharing some tips along with raising awareness, because most of the target audience could be new mothers, newly pregnant, so they might also be confused as to what's happening or how they can, so any sort of sharing tips, or probably maybe gifting hampers to all the participants would help increase the participation among the target audience. If anyone else from my team has any other points, maybe they could add that as well.
I'd like to add, maybe if we're talking about benefits, maybe this could fall into the part where we mentioned about maybe collaborations with local organizations, GOs and NGOs. So maybe we could be also supported. We can like have some sort of we can like what's it called, a cooperation where we could also provide let's say external assistance, like from us. They also gain let's say some sort of health benefit, or maybe I don't know, like checkups from other clinics. Like it could be provided also as a benefit from our cooperation with these other organizations. Thank you.
Thank you so much. Dr. Aksha, do you have also a question?
Yeah, thank you. Just very quick questions. You're mentioning Instagram as your platform for doing campaign. Can you try to estimate the proportion of pregnant mothers, one, who are using social media, and among those who are using social media, how many use Instagram? Just to get a bit of understanding of how many reach out do you think we can get? Thank you.
Yes, Isha, go ahead.
Yeah, thank you for the question. I would like to say that that's absolutely right, and we can expect the reach out via social media to also be less, because not many of them might have Instagram accounts, and even if they do have the account, they might not be that active, or they might not know how to use it to actually attend the webinar. In that case, what we were planning of is to not only have online but additionally offline meetings as well, to reach out to a greater number of people. And like we mentioned in the presentation before, it should not be just we should be able to collaborate with other NGOs so that the reach out is greater and people know that there is a webinar or anything like that going on. So I that's what I would like to say. If anyone else wants to add anything else.
Okay, thank you, Isha. I think I just
do you want to add on?
Okay, I just want to add up like a bit of points. So from my short research, I found that the user for Instagram and also like social media from, so we estimated that the newborn mothers and also like pregnant mothers are around Gen Y or Gen Z, but and the user is quite high. It's like around 60 to 80%. So I think the use for Instagram is still useful, but maybe the scope can be like expanded if we post on the like publications to the accounts that is being followed by those mothers, such as from the GOs and NGOs. Maybe that is addition. Thank you.
So thank you so much for this intriguing Q&A session. So now we're gonna go on with group 5. Group 5, time is yours now.
Hello everyone, am I audible? Okay. Hello everyone, myself Mansi Deshmukh. I am from AMSA, Kyrgyzstan. Today I will be presenting Group 5 with Stomel and Kenova. Our topic is online-based health campaign. Next slide, please. So our case is this pandemic has reformed various activities to be held online. So there is an Y campaign online which is initiated during pandemic in 2022. It directed towards the pregnant mother and newborn mothers. This campaign, they usually explore awareness projects by posting Instagram stories about early life nutrition, particularly during pregnancy, birth, and warning. Um, food, food given to 6 month old child. These Instagram stories were posted by the medical students in their personal private accounts. Moreover, Y campaign also includes an online webinar that invited a medical nutritionalist to share a lecture about the topic. However, due to the late confirmation of the speaker, the webinar's poster was only published 3 days prior to the event. The webinar has 47 participants attending, most of which were medical students organizing it as well as their peers. No questions were asked during the Q&A sessions. So the purpose of this campaign was to raise an awareness about early life nutrition, focusing on pregnant and newborn mothers through the Instagram stories and webinar organized by medical students. The campaign aims to educate about nutrition during pregnancy, birth, and warning, despite the challenges of the pandemic. Next slide, please. I'll be addressing the first question, which is the factors that went well in the Grivan project. First is the Instagram story is a good way of publication as it reached a broad audience and creating awareness about nutrition given to the pregnant woman and the newborn child. The leverage of Instagram stories to reach a broad audience, including those who may not have otherwise access to such information. Secondly, the webinar was conducted online to reach excessive audience and to reach a broader perspective and provide an interactive campaign. The campaign has benefited the necessary topic for mothers. This topic itself is important and should be addressed. The fourth is inviting medical nutritionalists provide proper knowledge regarding the nutrition of pregnant women and child. Despite the late confirmation of the speaker, the webinar attracted 47 participants, indicating the significant interest in this topic. Now, I would like Romel to continue.
Okay, thank you so much, Mansi, for the change. Now, I would like to continue to the second question: is what has potentially been misdirected or suboptimal in the project? Criticize it. So there's a 4 point that I would like to highlight. The first one is late publication of the event details likely hindered attendance rates and caused potential participants to miss out, indicating a need for earlier promotion. The second one is lack of engagement during the question and answer session. Suggests a missed opportunity for meaningful interaction and knowledge exchange. So it's only a one-way communication. The third one is reliance on medical student personal Instagram account, and it may limit the campaign's credibility and reach, while private account may have a restricted exposure to external participant. And the last one is inadequate interaction with resource person reflect a lack of effort from the committee in respecting their expertise and maximizing the engagement. And the next question is be presented by Kenoa.
Okay, hello everyone. My name is Kanoa. I'm from AMSA Indonesia. We'll be presenting the next question. In this section, we have brought up some solutions that could have prevented the problems in the online event, the online webinar. But also we also brought up an offline event to better conduct the main objectives of the whole event of it in itself. So for the online event, for the speakers themselves, they are supposed to be from health organizations or professionals, and this is to contribute to the campaign content and also enhancing the credibility and reach. But it also has to be accompanied by prolonged promotion of the event from early on by social media accounts that are not private. So the organizing committee themselves, the member of the committee, they should have an unprivate account or also to promote the event, but also there should be a main Instagram account that could promote the event from a central account, mainly the local organizing AMSA's account. And also, we could also actively encourage participant engagement during webinars through interactive features like live polls or dedicated Q&A sessions. And also, we could establish a feedback mechanism to gather insights from participants, mainly from Google Forms. And for the offline event that we brought up, we should conduct an offline campaign in areas with low access to technology, particularly rural regions with low income demographic. And to do that, we could work with the local coordinators to organize and promote the event and gather the data of the demographic with which has pregnant women in that area. And the reason why we target this particular demographics because by statistic they're bound to be less educated, and because they're less educated, they probably have a low knowledge of nutritional understanding and value, and that is harmful for them if they don't understand that, especially to themselves and to
I'm sorry, I have to cut you up. The 7 minutes are up already.
Oh yeah, all right, thank you.
Sorry. So now we're gonna go on with the Q&A session. So if any judges wanna ask questions, please raise your hand again.
I'll just jump in then. My question is that okay, Soraya? Okay, good. Yeah.
Yeah, sure.
My question will be, how do you improve engagement or interaction sessions with pregnant mothers? What kind of methods would you use to improve their engagement? Thank you.
Hello, I'd like to answer that. First of all, as we told in online and offline events, we can just take a small Q&A session regarding what they know as are factors limiting regarding nutrition, like what they know is good for them and what's bad. And this is the first thing. Second thing, we would like to distribute manuals and handbooks to the mothers so that they can get more interested regarding the topic, and their knowledge would be increased regarding the nutrition of during pregnancy and post-pregnancy. I would invite my other group mates to continue. Thank you.
Yes, Jericho, do you have a question?
Yes, thank you so much for that presentation. So I just have one question about how do you measure the that all the participants will have a lasting impact on their health behavior or health, given that, as you mentioned earlier, as the presenter mentioned earlier, there's a factor of low health literacy, and then so how do you measure the lasting impact of your advocacy campaign among these participants?
Okay. So first of all, as mentioned, we will be conducting feedbacks from the participants. First of all, in the feedbacks, we would like to take the personal information like their contact numbers or details. Then also we will be collaborate. We will try to collab with the maternity hospitals in which they are taking their treatment. Um, through their during their pregnancies, and we will consult them as well as the doctors regarding their development throughout their journey, pregnancy journey.
Thank you for this Q&A session. It was very interesting. Now in group 3. So group 3.
Okay. Sorry, I'm the GM for Group 3, so I'll share my screen. Hold on.
Okay, thank you for Louis. So allow me to present the result of our discussion. So the program that we conduct and based on the case. Maybe next move to slide 10, Louis. Okay, thank you. The program that we conduct based on the case and our discussion is elementary to high school student health education next. So here are the overview of the program and the limitation of the program. One of the limitation of this program based on the case is lecture formats make it interesting for the student, and not all schools are enticed in joining the program. Next slide. So here are the pre-program solution. So we will conduct a need survey of the target schools prior to the program, so that we know what they actually need in terms of health, such as nutrition, hygiene, etc., and create additional programs such as creating advocacy or campaign tools to make sure schools are interested in joining the program. And the last, this program targets students from various strata, so that the program is informed to school students of all age. Next. So here are the solution of the program based on the case. First is create different programs that caters to elementary to high school student. For middle to high school, we want to make lectures and post-lecture competition with prizes such as graphic video and upload it to Instagram or TikTok, or public poster competition. And the last, we want to invite the student to participate in a nutrition campaign. And for elementary school, we also have lectures in the form of puppet show or mini drama to deliver the lectures. And we want to invite the students to a cooking demo to create healthy foods like sandwich and salads, to applying knowledge from the lectures. And we want to work with schools to introduce new and improved menus in their canteens or school environment. Next slide. So that's all from our presentation. Thank you for attention.
Thank you so much for this presentation. Now we can start the Q&A. If any of the judge have any question, please raise your hand. Oh, Dr. Aksha, yes?
Yeah, thank you. So my questions will be regarding the problem or the needs. Why would you think high school students need sort of this activity? Do they feel that they have the issues about it? So we should bring them those kind of solutions. What health issues regarding diet or nutrition do you think they have or they need? Thank you.
Okay, maybe I'd like to help in answering. So I think personally, from my perspective, since there is, from what I've known, since there is kind of like an increase in like the burden of malnutrition, which includes like overnutrition or undernutrition, I think nutrition is still kind of relevant to be discussed and to be informed to high school students. And this topic is also included. And since there's also, I presume there's like a shift in their types of diet, I think it's still important to sort of still inform high school students on the importance of consuming vegetables or having a healthy and balanced diet. Maybe that's what I'd like to answer. The answer from me. Thank you.
Okay, thank you. I think I see that Kenan also have a question.
Yeah, thank you so much. With a relevant or similar questions with the capture regarding the content itself, but basically, like, what do you think is the main reason that like high school students, like, if they're malnutrition or overnutrition, do you think health literacy was the main reason of that? Like, because that was the design of the program, and if not, like, if you do not think that the knowledge was an issue, what do you think is the main issue, and how would you like to address that issue? Thank you.
Okay, maybe I'd like to help again with answering. I think in terms of high school students, since we part of the target was private school, I don't think that health literacy is the only thing that should be the center of the focus when it comes to changing their health behaviors. I think there are a lot of factors, including income, that could also influence these high school students in terms of their health. So I think it's still kind of multifactorial, but I still think that education still plays somewhat of a part. So the public health project with health literacy, I think, is still quite relevant. Thank you so much for the question.
I have another question regarding this. Well, thank you so much for your presentation. I just would like to clarify, are you considering to expand the scope of your research? Because as I can see here, it's only the upper middle income students. So do you consider expanding it to other economic strata, such as the low middle or low income students?
Okay, maybe I'd like to answer also. Sure. So I think the revision of our project is actually to kind of shift it from only private schools, since the reason why it's only private school in the first place is because a lot of schools did not respond or did not want to interact with the program. So the original program was to actually to widen the scope, to not limit it to only private schools with upper middle income, but also to probably public schools, so that since the private school, they already have this extensive balanced diet canteen, whilst public schools probably don't have adequate funding. So yeah, I think our scope is actually quite wide, but since at the start it was limited by their interactions, with limited interactions with public schools, we want to try and improve that so that we can always widen the scope.
Okay. Thank you.
Thank you so much for this very insightful Q&A session. Also, thank you to all the groups for your amazing presentation and insight on the various public health projects that we have shared with you. I would also like to first briefly introduce our new judge here from GHF. So Jericho Gaya, he's a medical technologist from Far Eastern University, Manila, where he developed a strong foundation in clinical laboratory science and public health, shown by his various awards. Inspired by his active involvement in community engagement, Jericho witnessed firsthand the profound impact of health inequities and misinformation on individuals' lives at the grassroots levels. Currently, Jericho serves as a researcher at Global Health Focus and recently became the program manager for GHF University Excellence Initiative. So again, welcome here. So now we would like to listen more from the judges on their comments. Please enlighten us on what solutions would have been ideal for the project cases and what would you particularly highlight from the previous presentation. So we will start first with Yob. So Kenneth, the time is yours.
Thank you so much. I wasn't expecting I'm the one going to speak first, but that will be fine. So once again, I think there's a lot of good presentations that have been made. I think especially how different groups tackle it, not only from a health perspective, but there will be a lot of socio-economic things that comes into when we're discussing global health. It's not only there's a lot of practical stuff that we might have to solve, especially, for example, for organizations and how we would like to attract people. When we're trying to address the issues that were really on ground, what people need, but what rather than what we are providing. So I think these are some of the gaps that I think those cases want to showcase that what have been demonstrated might not meet the local or the ground needs. So coming as a medical student background or a youth advocate myself, I would definitely say that I think a lot of partnerships could be definitely done by with some of the local medical students. So for example, for the rural health checkup, I think to ensure that sustainability, I would believe that rural area might have some medical schools nearby or in a shorter period of time. So that might be something that you can work we can collaborate with other youth group, because there's actually a large youth group or large youth demographic groups. And then another thing probably will be some of the for example, if we're having the high school education with students with high schools, we can actually further motivate them to work on their own health initiative that will, for example, they can share that knowledge to their communities, especially they're relatively privileged in the background, for example, them from private schools and then the government subsidized schools. I think one of the things I remember my first question was actually asking about what might be the differences with the government or the public school and private school. I think most likely, from my impression, private school are more flexible and then they might be easier to collaborate. But I think at the end of the day, it should really map the stakeholder out and then find what they want. For example, for public schools, they might have more bureaucracy to go through that. So you might need more times, more detailed documents, and even you can provide successful stories from collaborating with private schools, and then further to convince people, for the public schools and stuff, that these are successful stories. You're not coming just for fun, because I think within Asia, us as medical students, sometimes we're not as regarded as a power to make changes, or we will be regarded, or we're just going there to have fun, or we're not capacitated enough to do things that in a global health setting. So I think within the communications on especially working with different partners, that will be something very important on global health. So I think I kind of touched on the rural health cases and nutrition cases. Let me see if I missed anything. But yeah, I think I really like, especially I think some groups also touch on policies and also the medical education syllabus. That's something that we can further explore. It's not only on the health initiative itself, but we can further advocate on, for example, any policy changes. So I think, I think that will be some of my general comments. But I really appreciate every group effort, trying to squeeze everything within a limited period of time. So I think that's what I have for now. But yeah.
I totally agree with you. The group indeed did a great job, and also we indeed have to start from high school. Start early is better. So thank you. So next, we would like to hear from Dr. Akcha.
Yeah, sure. First of all, thank you very much for inviting me, and for Sydney, who always reminding me every day. So she sent email every day, literally to me, I think, to make sure I join this discussion. First of all, it's great to listen to all of your presentations. I think you all have the potential to be future public health or health leaders in the future based of what you've presented. I think the center of focus on this discussion is not really substantive on what's the medical issue or health issue, but for how do you ensure your project is actually implemented, or you can run your project when you already design it. So my general comment, when you and based on my on also experience and our organization experience, either in the Ministry of Health or in the WHO. First of all, when you try to design an intervention, or going to the field, really understand what's the problem statement is in the field. And many of you already have talked about need assessment, talking, even some of you think about sending one or two small teams to go and check what happens in the field before you actually plan what you do. Some of the problems here is actually trying to also address inefficiency, to ensure that when you go there, you bring the adequate supplies you need that actually needed by the people. So one, really understand the problem here is really important. Talking to the local health offices, seeing the data, seeing the charts, seeing the report from the past months, past years of the area, really understand what's the community. However, in many cases, in some cases, you may not be able to do that. There may be a very limited information online, so that's how you actually need to try to find a proxy. Maybe ask the local health officers, or at the government, at the province level, see if they've ever been to the district yet, to the area, and ask them the latest health status there. So one, understand the problem. Second is to really make a good plan or design of your interventions. And it can be done by through anything. Many people, and don't be discouraged, and don't be don't don't think that everything should be a novel program. Oh, we should do digital, we should do doing online, we should do like social media, we should do like Instagram. Maybe or maybe not, it will effectively target your community where they don't even have a phone. You cannot do like a social media Instagram to them, right? There's so many existing interventions that may exist already in the area. And sometimes what we can do is actually just to improve the coverage, or just to maybe change a little bit, or maybe just change the methods of sort of interventions for a certain program. So really see what's the landscape of interventions being done to the area yet. That's really important, so you can see the gap. So our job is to see the gap. One is the gap of the problem, like the health status, and then what's the current, and so you know where you get into. And the second is the gap of interventions, what has been done yet, what has not been done yet, and that's where's the opportunity for you to get in. And then maybe there are guidelines. So as a medical student, I know you're all medical students. In medical students, we're always been taught that we need to work effectively according to the guidelines. And if there's such as a previous current guidelines, current global guidelines, current national guideline or local guidelines, use that as your kind of compass to design effective interventions. And CPA studies, there's so many studies, systematic review, or just a very local case report that you can use and adopt and learn when you design your interventions, and make sure that your interventions really use the right. It's not always the ideal, but it may be the best available for your community. Sometimes what you can do is just provide like a flip chart, because it is something that you can put in the district office, sorry, village office, that people can just go in and then read it and go back to their house. So some really tailored to the community needs. And last, I think, do the evaluation, please. Every time you do a project, do the evaluations and make records of it. If you can publish it, it's good. If not, it's okay. If it's just, record it and post it in your social media so you can remember it, or so others can, read it. It's very important, because there's so many interventions. Sometimes they feel that it has not been done yet because people don't write it, right? People don't post it, people don't share it, they keep it for their own. So write it and publish it. And last, for you, as a medical students, don't be discouraged that is it like our duty to do like this kind of project? Is it benefit? It will be beneficial for all of you. I've been like scabious. I did that in there's a small island called East Nusa Tenggara in Indonesia. I did that. I went there for like 2 weeks, do the same kind of intervention. So talking about like we don't have permethrin. I've been there before, and truly shape how I will do my next interventions. How I could prepare myself better for my next project. So don't be discouraged if you have the opportunity to do this kind of intervention or project. Do that. Take that opportunity. If you think that you will need a lot of resources, find the resources. That's our job as a health leaders, to find the resources. It's not because we don't have the resources then we cannot do the interventions. So our intervention is not just providing medicines. It's not just finding the permethrin. Our job is also to find the resources, as previous judge also said, to shape the policy. That's also like our a noble job or mission here. I think that's all for me, and congrats to all of you. Thank you.
Thank you so much, Dr. Akshay. Indeed, I think we truly need to go back to the rural community to really understand their problem, and then from there work on a plan and everything. So thank you. Last but not least, let's hear some comments from Jericho.
Hello. Thank you so much, everyone, for having me here as one of the judges for this masterclass. So I was once a participant in this global health training and masterclass by AMSA, which actually paved my way to becoming a global health researcher in global health focus. And I've already made several publications in Scopus. So I am very delighted to become a judge here, as I witnessed how your presentations are very tailored to, especially the rural health. I'd like to commend that the tailored approach, how you diagnose the community environmental diagnosis, a community diagnosis. So those are very crucial methods for making a research feasible and very relevant to the society. And first of all, of course, I'd like to commend everyone for delivering a great presentations about addressing global health issues and promoting health through digital platforms and such. So as we global health advocates who works for addressing global inequities, we should also make sure to represent those underrepresented, because it's our way of making them known by the world, so that the intervention could come to their place and make their population become more healthy and ensure that they are not left behind. So these scientific works that we are developing for our, of course, for our in a micro level for ourselves, and of course, in meso level for our community, are very important in creating evidence towards achieving the Sustainable Development Goals of the United Nations for 2030 agenda. So congratulations, and I hope everyone. I just would like to make sure that everyone is already enlightened how you do your methods, and make sure that you always have your reference for external validation, so that there will be lesser issue when it comes to your defense or publications in such to scientific journals. And yeah, I'm very happy to be here today. Thank you so much.
Thank you so much. Very cool indeed. References are quite important for research. So thank you all judges for your insight. Next, any questions for our amazing panel of judges? You may type your questions in the Zoom chat features or raise your hand if you would like to voice out your questions. So I noticed that someone had a question. I think it's from Isha. Yes, Isha, go ahead.
Thank you so much for recognizing me. Am I audible? Okay.
Yes.
Thank you so much, speakers. Your thoughts are really helpful and insightful. My question is in general to all the speakers. I have organized a few public health projects here locally in India, but there was this, I had a doubt as to how, one of the problems I faced was when you work as a team organizing such projects, you realize that the people who are working in your team, there are a lot of differences in terms of how to implement. So how do you be inclusive of all the ideas at the same time ensure that the quality of your public health project is not hampered? So if there's any tips or suggestions on that, it would be really helpful.
Maybe I can go first, especially from also a medical student perspective of health profession perspective as well. So I personally had some, of course, we do face similar situations when collaborating not only on the national level, local level, when it goes to a regional or even global level. I think those differences of ideas will definitely be wider because we come from different backgrounds. We have how we learn about global health are different, so definitely there's coming to different perspective. I would just probably just echo to both speakers aspect what have been spoken earlier about, for example, external validation, some of the reflections on like some of the existing initiatives that might get implemented at the local. So because that will be able to identify what might be what might be more beneficial to the local community or the community that you would like to work on. I think one of the reasons why those differences of idea come from, because they might come from previous successful experience on having different global health initiatives. I think one of the things I think also highlighted in this masterclass is that the target audience will be different. The time frame that we're doing this will be different. So there might be this, like the successful formula cannot be replicated. And there's always no standardized format of like what is the best of the global health or what is the global health intervention should be implemented. So if it's a series of intervention, definitely going for review, like pre-questionnaires and post-evaluations, I think those will be great. And regarding the during the discussions for the first like event that you're trying to plan, sometimes I'll probably we'll do some discussion of harnessing different advantages from different perspectives that might help as well. But I think the key is not the first things that you did, but the sustainability and a lot of like reflection and feedback to improve and ultimately, because like it's more like a rolling a dice. You probably at the first time you don't know like what will be the best for the local community. So I think for accessibility management always will be pre and post evaluation. and then we can change and reflect on the intervention fee. Like, so that's what I think. I'm not sure if there's anything from the other two speakers.
I think it was really well answered. Is there any other who wanna answer? Wanna add on?
Isha, can you please repeat your question?
Okay.
Hello. I didn't quite catch the question. Sorry.
Yeah, sure. So my question was, when we are organizing any public health project, as a team, how do you ensure that you include the points of the difference? There are a lot of differences when it comes to how something has to be implemented. So how do you include all their opinions at the same time, ensure that it doesn't hamper the quality of the implementation of your public health project?
Regarding that, when working with global health projects, we usually do the this is from the perspective on how we in GHF do the work. So we usually do the external validation and always make sure that the integrity of the data that we are collecting are it is in utmost level. And also we do the target setting for us to tailor our approach and make sure that our data are very reliable and subjected to ethics for that reason.
Thank you so much,
Thank you so
speakers. That
much.
was really.
Yeah, thank you so much. So, does any other participant have any question they wanna voice out? You can raise your hand. Okay, so I actually received a question. It's to Dr. Aksha. So, they wanna ask that you mentioned about the importance of evaluation, yet sometimes not all programs can be evaluated. We can evaluate knowledge from post tests, but it's unclear what we can measure from a health checkup. So, any tips or best practices on this? Dr. Aksha? If not, Kenneth or Jericho, do you have any answer to this question?
I'm sorry, can you please repeat the question?
Sure. So they want to ask, so there is an importance about evaluations through the program or research.
Okay.
Yet sometimes not all programs can be evaluated, right? So they ask if in the case where we can evaluate knowledge from post tests, but it's unclear what we can measure from a health checkup. So in this case, how can we what can we do? Like, is there any tips or best practice on this?
So regarding that question, for evaluation, we also do the pre and post so that we measure the impact of the intervention or the project that we have implemented to the community. So if there is such things that you can't evaluate, we just put it in. If there's no other way to evaluate it, we put it in the scope and limitations so that we set it as so that it won't be questionable for the and we defend the criteria or the reason behind the limitations that we have encountered during the process of the research. And the subject that you asked is about checkups. Is that correct? For
Yes.
checkup, what was the certain what was a certain situation that you encountered during the research evaluation about checkups? Like, is it for the is there any issues with ethics issues, confidentiality?
I'm not really sure, but I think they meant ethic issues
Oh, okay.
mostly.
So if there's an ethics issues, what we did before when we conducted a case studies for a hospital, we just put the patient into anonymous so that we won't be violating any confidentiality issues. That's what we practiced. So I'm not really sure about the other panels.
I think it also works quite well. Thank you so much. So before we let you go, we would like to present you some several e-certificates as a token of appreciation. And also we would like to take some pictures with you. So so first with Jericho, thank you for insight as a judge panel in our masterclass. Please, Samuel, can you please document this for the picture? Oh.
Okay, I'll be taking the screenshot. Okay, smile for the camera. I'm taking in 3, 2, 1. Okay, it's done. Thank you.
Thank you so much. So
thank you.
Thank you so much for joining us today. It was very insightful. So next we have Dr. Akshanor. Thank you also for insight as a judge panel in our masterclass. So Samuel, can you again please document this for us?
I think Dr. Aksa is still calling. Is it? Okay.
We can maybe
Okay, I'll be taking the picture in 3, 2, 1. Okay, it's done.
Okay. Thank you so much, Dr. Aksha. We are sorry for disturbing you now. So last but not least, we can go on Kenneth. Again, thank you also for your insights as a judge panel in our masterclass. So again, Samuel, can you please document this?
Okay. Taking the picture in 3, 2, 1. Okay, thank you.
Thank you so much.
Okay. Thank you for joining us today. So once again, thank you very much to all of our judges. We look forward to future collaboration with all of you and your organizations. Yes. Feel free to leave the Zoom meeting if you would like. You're so very So our next session we start at 4 p.m. GMT +8. So now we'll have a 6-minute break. So see you soon.
Thank you, everyone. Good luck on your research.
Thank you so much.